Every cloud has a silver lining. That implies one should have inherent optimism in facing life challenges. A young, one-eyed patient, only viable eye vision of PL, always accompanied by someone. He was denied surgery everywhere, but he had glimmer of last hope and came to our hospital. When the patient presented to me, it was not less than a nightmare to think of operating on such a patient. But I have the belief that beyond the gloom, something positive awaits. So this is a video of patient hope in my audio. This is the right eye of a 22-year-old male having the vision of only light perception with inaccurate projection of the ray. There was a occlusive pupil with complicated cataract and 360-degree synechia is present and IOP was 28 mm Ag. Other eye was thysical valvi. I decided to do the phacoemulsification with IL with pupil expander and intravitreal injection of the triamcinolone. After making the side foot, Bisco injected vigorously, so deepen the chamber and break the synechia. And clear corneal tunnel is the made to avoiding the area of the anti-synechia. Now I saw the pupillary membrane was very thick, so I decided to cut with the help of the one scissor, and then I try to peel off the membrane, but membrane is very thick, so I have used the retractor to cut the pupillary membrane. With the help of the retractor, so I try to make a pupil slightly circular. Posterior synechia was broken with the help of the iris repositor. Then I used the B-hex ring to expand the pupil. After that, cystitome used to give the nick in the entry capsule, and then rhexis is completed with the atrata forceps. So lens was very soft, so we kept the phaco-parameters very low and then tried to aspirate the lens. As I was aspirating the lens matter, there was a inadvertent jonular dialysis. So after inserting the CTR, aspirating the lens matter is very easy. And then I try to inject the foldable lens. But the lens was very bulky, so refused to go into the bag after the repeated attempt. But unfortunately, the B-hex ring got engaged with the aisle. So I decided to remove the B-hex ring. While removing the B-hex ring, some vitreous prolapse I noticed. Some vitreous is seen to be pulled. So I had to do the antivitrectomy. I decided to cut the aisle and explant it. The rhexis margins were intact and bag appeared fine, so I decided to use the less bulky PCI and was easily inserted into the bag. In spite of all the difficulties I faced, at this point I felt happy. But picture abhi baki hai. After the lens stability confirmed, I gave the intravitreal injection. So when I injected the intravitreal triamcinolone, I noticed the air bubble inadvertently got injected. Due to the air bubble, I was slightly displaced toward the antechamber, tilted out of the bag. So soon there was iris prolapsing through the tunnel. In spite of repeatedly hydrating the port, oil was not remaining stable. After antivitrectomy, I reposited the iris and closed the case. On the seventh post-op day, his vision was counterpinker. There was a dense fibrin membrane in the antechamber. Oil was decentered. So I took the patient for iodine. Iris lens capsule adhesion were also released. After 1 month, patient was happy. His vision was 6 by 36. So all's well that ends well. Just as the sunlight break through the cloud cover, so to do movements of grace and resilience shine through in our life. As my mentor says, every cloud has a silver lining. Hurdles are like passing clouds which cast shadows, embrace optimism. Thank you.